Hello, my name's AJ Diliberto. I'm an insurance agent here in Southern California, and I just want to share actually a couple of my philosophies and how we are deductible busting, and just some of the tools that I have found out there. So I'm giving up some of my secrets here today. So feel free to use them as you wish, and of course, if you want to get my mindset, some of it, today's day and age, this law is as much about art as it is numbers. And so you can just pick a plan. But again, with the plans, what exactly do they do? What do you need them to do? And how can you package up your situation with the plan that you want and maybe some of these deductible busters to lower your premium, provide better coverage for your family? That's really what it's all about. So that's my philosophy as I come in. I just really want to help you save money. I know some agents are out there and they kind of want to just kind of figure out your budget and then fill the budget with whatever products. I take an opposite approach. I realize you want to save money for the most part, but you also want a certain amount of coverage. So there's a yin and a yang all the time with those kinds of situations of what are you willing to pay for what you get, and then again whether or not one of these deductible busters will suit your needs. But so I just want to talk about two deductible busters that I use on myself, and I use them pretty widespread. One is an accident plan. It's actually very, very inexpensive. It's like $23 for an individual, and for an entire family under $40, like 30. I think it's 37, $38. So it's awesome. You get it actually will cover your out-of-pocket medical expenses up to a dollar amount. Let's say $7,500 is a number I like to use. So for 35, 36, $7 a month, and less if you're an individual, you can cover all of your out-of-pocket medical expenses up to $7,500. Well, think about it. Broken leg, you accidentally cut yourself, slip and fall, car accident, whatever. All of these things find themselves into you got the emergency room. And then, of course, they're taking x-rays and doing whatever because they're trying to cover, their you-know-whats. And so you can't really tell them not to do this. You went to the emergency room. And so then you're going to get a bill for that. And then, of course, if it's something, you've got other doctor bills and all these other things that have to happen, x-rays, MRIs, whatever. And so you need coverage for that. So for a very, very small cost, so we can have a high deductible if we don't normally go to the doctor a lot, maybe have a plan that maybe pays some doctor visits or maybe not. Or maybe it pays for prescription medicines, or maybe not. Maybe you just go with a bare bones plan, but you cover your deductible and your max out of pocket with this accident plan. So anyway, phenomenal idea. I've used it for myself for years. My daughter tore her ACL. It was an accident, so I got it paid for. My son then, the next year, tears his ACL. As crazy as it is, used it again. So I've actually used this policy twice. I've had other people use it. Their children, someone got a ball, smashed to their face playing basketball, broke their nose. They used it. Somebody else, again, kids with sports, all of these things. I mean, these are our biggest risks as parents, is that our kids are doing something, skateboarding, playing a game, football, whatever it is, soccer, and they get hurt. And next thing you know, we're out $5,000, $6,000, $7,000 because of max out of pockets and surgeries and different things that might have to happen. So anyway, awesome deal. Feel free again to you can get a hold of me. Just send a message on this YouTube page. You can get a hold of me at, that's the easiest one, probably AJD1000 at gmail.com. I've got another one I use for my insurance, but it'd be too hard to get. So AJD1000 at Gmail. Go ahead and just email me and just say, hey, listen, I'm looking for deductible busters and ways to help me with my insurance. I'm going to do another video here in a second about the plans themselves and ways to save money on the actual plans. Now, the second deductible buster is something that I really haven't really promoted that heavily, to be honest with you. I was guinea pigging on myself, and basically I bought it for me and my family a couple years ago, and my thinking was that I was probably not going to keep it. So I didn't want to promote something that I'm not doing myself or I don't believe in myself. So, but here it is 3 years later, I think 4 years later, actually, I still have it. Every year I decide to keep it. So I figure, I must think it's valuable. So anyway, and this is the hospital stay deductible buster. And again, very, very reasonable. I think I pay, $60, $70 a month. It's not a whole lot, but it covers me and my entire family for a hospital stay. It gives me like $1,000 a day for the first 5 days, and then it gives a little less, going down. Now you can have one that's a little less, 500 or 750 or something. But my idea here is that if I'm only in the hospital 2 or 3 days, and I get, and not, for whatever, I've had people this year, every year actually, but this year for sure, there's got to be at least 5 people that I know who ended up in the hospital for 2-3 days with 104, 105 degree fevers, and still don't know why. They ran tests, they were there, and were looked at, and just eventually the fever broke, and to this day still have no idea why they were there. And that's 3 or 4 different people this year, and 2 were related, one was a client, whatever. But it's it's a scary situation when you find that you have to go to the hospital, and that you've got a $4,000 or $5,000, $6,000 deductible. You may not go. It could be life or death. So for some reasonable price, and again, as single, it's going to be way less than that. I've got a family of 5, and I'm still at $60-$70 a month. I forget the exact amount, but it's a very, very reasonable price to cover this event, that in the event you end up in the hospital, you've got some coverage. And so again, if I'm there 3 days, I get $3,000 back. So maybe my deductible is $2,500, maybe it's $5,000, but still I've got some coverage against that I can use to help me with the deductible. And if I'm there 5 days or 6 days, then I'm going to cover my whole deductible with this policy. And that's the best that there is out there. There's nothing else better. I look all the time. If any agent's watching this, something better, email me. Let me know, because I am always looking and hawking. There's all these fancy dancy things that cost a lot of money, and I'm not interested in costing a lot of money. I can make a lot of money selling a lot of things. There's some things 30% insurance, 30% I can make on $200, $300, $400 plans that do not even as much as this plan does for under $100. I'm telling you, there's a lot of things out there. You got to watch it. Same goes with a lot of the different insurances. So I'm not here to, I want to help you save money, protect your family properly. These are things I've done for me. So again, I'm not paying $200, $300 for something I can pay $50 or $60 for and get really good coverage. So with these combinations, I can actually afford to have a lower deductible or higher deductible. Know I'm covered in the event of an accident. Know I'm covered at least some, maybe all, in the event of a hospital, and save literally hundreds and hundreds of dollars every month. I'm going to do another video where I'm going to talk about that a little bit, but you're talking about the difference between $2,000 for sort of, middle of the road coverage, all the way down to maybe, $700 or $800 a month. And that's big stuff. That's big stuff. And with health insurance costs what they are today, we need these deductible busters. So anyway, there it is, AJ DiLiberto, AJD1000@gmail.com, or go ahead and make a comment here below, private message me, make a comment on the YouTube thing, whatever it is. I'm not sure all the places this video will end up being, but I will be happy to help you out in California. Unfortunately, I'm not in other states. There are some plans, by the way, in other states that even do a better job than what I'm describing here. There's one of these products is unbelievable. So anyway, find a good agent. If you're not in California, find a good agent. Find someone who understands these deductible buster kinds of situations, and do the best you can this year. We're all in it together. Talk to you soon. Bye.